Hello, I am Dr. Mary Jo Ruggieri, and I'm a holistic health professional. And welcome to Staying Well with Dr. Mary Jo. Let's talk about herbs, herbology, the benefits of herbs. Unbelievable. This next series that we are going to present to you are called Herbs for Life. And this is profound because non-invasive, they are popular, they are becoming, fashionable in many cases. No side effects. Very rare do you find any side effects with herbal medicine and herbal health care. So we are going to present to you a series of herbal education, and with our master herbalist, Harula Dentopoulos. She is part of the Institute of Holistic Health Careers faculty, and our herbal educator, Letitia Bunge. Have you wondered if you could have just even a whole idea of herbs? We're going to talk about herbs for digestion, herbs for the liver, herbs for the colon issues, anti-inflammatory, colds and immune systems. Everyone knows, oh, I'm going to get echinacea, I'm going to get golden seal. But let's talk to the professionals about this. Herbs for the nervous system. So please enjoy the next series on Herbs for Life and Staying Well with Dr. Mary Jo. Thank you.
Hello, and welcome back to Staying Well with Herbs. Our segment for this week is about analgesics and anti-inflammatories for pain. And many people use non-steroidal anti-inflammatory drugs, or NSAIDs, for pain. But there are a lot of problems with NSAIDs. Things like gastrointestinal bleeding. It increases your stomach acid. It decreases the mucus in your body, your stomach and your intestine, that's specifically there to stop pain and keep the tissues coated. It can also increase your blood pressure and cause kidney problems. So there are definite reasons to avoid NSAIDs if possible and to try some herbs. Last week we discussed mucilaginous herbs like marshmallow and slippery elm, which are full of water, and they help coat the tissues. They also help cool the body and lubricate the body, and that definitely helps with pain from things like ulcers in the gastrointestinal tract. And now Harula will talk more about specific herbs for pain.
Hi, I'm Harula Dentopoulos, and glad to be here again today. So there's 3 herbs that I would like very much to mention today briefly, and one of them is willow. It could be either white or black willow, and the Latin name of that is Salix. Then we have meadowsweet, and the Latin name of that is Spirea. And finally we have feverfew. Now I mentioned the Latin names for a reason, because for at least the first 2 you might recognize the sound of them. One of them is related to aspirin, and the other is related to salicylates, which go into the commercial drugs that Letitia was warning us about. The fact is that these are the main ingredients of the original painkillers way back in the beginning of the 20th century, aspirin and the whole family of salicylates, because that's really how drugs first started, as extracts of plants. So we drink them as infusions, as decoctions, as tinctures. That is a lot safer. White willow is another bitter herb. We've been talking a lot about bitter herbs in this Staying Well with Herbs, because bitters tonify. They're really wonderful tonics. Bitters cool down, meaning they're antipyretic, they lower the fever, and they're anodyne. They stop pain. Anything that you can imagine, from headaches to arthritis to joint pain to low back pain to tendonitis. White willow is really very effective for these types of conditions. It's a beautiful tree. It's another one of those wonderful plants that we have, trees that grow near the water, and actually its presence near the water indicates a cooling, a slowing down, an anti-inflammatory effect on any kind of part of the body that has pain and inflammation. The white willow is especially good when it's used with meadowsweet. Meadowsweet, sometimes even the third one I mentioned, feverfew. and different mucilaginous plants that we've been talking about. Meadowsweet is also a bitter, and it has been used in ancient times. The name aspirin came from its Latin name spirea. It is anti-rheumatic. It helps us sweat, and that will reduce the fever. It's antispasmodic. It's anti-inflammatory. Works mostly on the same conditions as white willow. Arthritis, lower pain back, any kind of tendonitis, stuff like that.
Now, is it bark
yes.
you use for the white willow, and
I'm
what
sorry.
part of the meadowsweet?
I'm sorry. The meadowsweet, you can use the entire plant.
Okay.
And with the white willow, you need to use the bark.
Okay.
Another herb that we will discuss in a further installment is licorice. That would also help a lot to help with pain like ulcers and urinary tract infections. Feverfew is another bitter, and it contains a very specific chemical called parthenolide, and those are very specific for migraines. A lot of us get migraines. Feverfew taken over a long period of time as a tincture in particular really has a lot of good effects on migraines. I've had clients who actually had very, very nasty migraines, and that taken over a period of 2 years really eventually got rid of them. It also works for menstrual cramps and any kind of aches and pains relating to flus in general. One thing about Feverfew, it is a blood thinner, so not good if you're on any kind of anticoagulants. All of this can be taken as teas. The bark of the white willow has to be taken as a decoction. And I want to say just a little bit about turmeric, which is one of the best anti-inflammatories that we have. But to get the full effect of it, instead of using it as a tea or root decoction, there is something available today, an extract called BCM95, which is extremely, extremely effective. And I think we've talked about turmeric before.
We have in a previous video. Also, could you talk just a moment about why in general you don't refer people to use extracts versus the teas?
I don't like extracts because extracts are, when the pharmaceutical lab or the herbal lab, for that matter, makes an extract, they take out 1 or at maximum 2 of the chemicals in the plant, instead of using the whole plant, which sometimes has up to 100 chemicals. So it's like saying that only this chemical is going to work, but we know better because we know that all the chemicals in the plant work synergistically with
Correct.
each other.
Correct.
And give it a lot more protection against the side effects and things that may happen if you isolate a chemical out of the plant. But with turmeric, it really does not do well just as a powder, as a spice or anything like that. It's better as part of an anti-inflammatory tincture, and I have tried this on people, the BCM95, and it seems to really work very well.
All right. Thank you for listening to this installment of Staying Well with Herbs, and come back next week and we will continue.